Hey.
Daily, health workers struggle to beat time. Yet, saving lives is a duty they must perform. A poor road network hinders healthcare delivery. No two communities are joined by a tarred road in the Wa East district. Commercial vehicles ply route less. It is not profitable. Commuting from one end to the other is therefore a headache. Two water bodies separate the district. Funsi, the capital, is on one side with over 20 villages, and Bilinga, another community with over 100 villages, on the other.
You cannot cross to the other side of the district without crossing the river. The water is low now, the tides are low, and so I can easily walk across. Motorbikes and vehicles, four-wheel drives particularly, can also cross. This will enable you to access the other part of the district.
Then the bigger of the two, the Kulien River. It takes courage to cross even at this time of the year. It is safe to cross at this time, but impossible when the river is full.
That's the scale you need to. There's a certain scale that you need to get to move the car from there. That scale is always gotten by these drivers who have worked here over and over again. This is exactly what happens here on the Kulien River every day. You sit on it, then it crosses.
Go.
But this one, it can't go.
It's to no go. It's too much. Well, water is too much.
Can't go up like this.
It's flowers. It's no day. It's
Flower, cover flowers,
yes,
all.
It's carved. That's car park. Water is calm. It's there.
The water.
There's the car, the park here.
You go all the way there.
Yeah,
Top.
Yeah, car park here. Water is calm. It's fly.
He's trying to tell me how the river can get filled up to the extent that you won't even see the vegetation around. We parked our car about some 5 minutes drive away. He said the water can get there so that you can't even park there when the water is filled up.
Medical consumables are not delivered on time. Documents are not signed early enough. Healthcare delivery is delayed. Pregnant women who need healthcare don't get it. They sit for hours waiting for healthcare officials who turn up late.
We have to travel more distance than the other district. So time that we would have used to work is always lost as a result of long travel hours. And aside that, the risk of being on the bike is very, very, very high.
District health officials have, however, devised means to deal with the problem.
In terms of logistic provision, what we do is to provide some at that section, bullying section for them, where the storekeeper will have to move from here to that place to serve them. And when there's the need for them to what we cannot provide, then we make a requisition for them to go to the medical store at the region to pick that one.
But this doesn't solve the entire problem. Their plea is for bridges to be constructed on the two water bodies.
The road network system in Wa is actually posing a threat to health issues in the area. Within the Funsi township, that is the district capital, sometimes we just use the grader to sip within, but the assembly will not have that capacity to finance graveling or opening up a road to link some communities.
If central government doesn't come in, that road, that's where if you have to cross 3 big rivers before you get to those communities. And so in fact, for the past 3 months, none of us could get there in order to render services to them. Through nobody's fault. So if central government comes in, just open up the place, make sure the road network is available. Then on the ground, we will also be filling up the patches there.
Quality healthcare cannot be achieved until the two separated parts of the district are linked by 2 bridges.